Today we're going to talk about running a PCV or packed cell volume and a total solids on an animal. So first of all, we have our lab coat on, we have our gloves, and we have our safety glasses as our PPE or personal protective equipment. We should do this whenever we're handling any blood, any urine, any feces off of animals, or doing anything in the lab, right? So we already had our patient, we drew our blood, we have our blood tip here, we have it labeled. This is from Polywog. You can't see that very clearly there, but we have our blood, we have it labeled. For this test, we want to put it in a purple top tube. So purple top has a product called EDTA, and this is an anticoagulant. This prevents the blood from clotting, essentially. Once you get the blood from the patient, within just a couple minutes, about 1 or 2 minutes or so, you want to put it into this tube right away so that it doesn't start clotting within the syringe. All right, so the way the body works is anytime there's injury, automatically those cells start clumping together, those platelets start clumping together and trying to protect that, trying to block it off so that we don't lose blood or our patients don't lose blood. So the same thing will happen in that syringe. So you put it in our tube here, and we want to invert it gently, at least 3 to 5 times. We don't shake it, just a general rock back and forth. Make sure that that chemical, that EDTA, gets mixed in with everything, and we're not going to clot at all. Always pay attention to your tube size when we do this. I don't know if you can see there. That'll focus in. Doesn't look like it will. This is a 3 milliliter syringe. So you always want to draw that amount of blood in. So we would draw 3 cc back, which would be to about where my finger is. I used a little bit of this and put it into the tube here so that we have it ready and available. If you don't use the right amount, there either isn't enough anticoagulant and you're going to have clots in here, or it may dilute it. If it's a product that has like heparin, heparin is a liquid that's going to be in there, and it's actually going to dilute it a little bit. So there's our tube. We also need our hematocrit tubes. These are tiny little pieces there, okay, little glass tubes. We're going to need our clay, our refractometer, and our PCV hematocrit reader chart. Right. Okay. So an alternative to putting the blood in the in our purple top tube here is if we draw just a small amount and we use it right away, we can just put it directly into our microhematocrit tube if we have the right tubes. So these ones are heparinized, which means it has an anticoagulant in this tube. So if you're doing it right away, you can absolutely do this. You will take your syringe, get just a little bit of a drop out. Try not to push too forcefully so it doesn't shoot out. And just touch the tip of your tube there. And you can see that it kind of crawls in. Okay, this is done through capillary action. So once we have some blood in our tube here, make sure you put your finger over the end. If you don't, it's a fluid. It's not real quick, but you can see that it's moving down through there. Maybe if you use your imagination there. So always put your finger over the end to block it off. We're going to take our clay tray and we're going to put the tip in here to block our tube. I don't know if you can see that. Yeah. See our clay plug down here. So that just blocked the end of it off. And then we have our blood in the tube. Don't fill it all the way. We want this tube about 3/4 of the way full. And later on here, I'll show you why we want that that amount in there. So from here, share my screen here. All right, so here, again, this is the equipment that we need. We already talked about all of this. So next, we're going to take our tray, or our tubes, and put it in our hematocrit centrifuge. All right, so this is going to take all of our tubes here. We're going to place opposites. So even if you only make one, you need an empty tube opposite of this to counterbalance it. If you don't do that, it will throw off the weight and it can actually break our centrifuge. This is more of a problem when we're spinning the big blood tubes or looking for fecals or doing urines. But just get in the habit of anytime you run a centrifuge, always have it balanced. So this one here, we have a tube here, we have a tube here, one opposite, and then there's an empty tube in the slot here. Okay. If you're running more than one patient at a time, always have a dry erase board, have a piece of paper, have something to mark which number goes with which patient so that we don't get them confused. So once we have those in place, you'll set this plate on top and screw it down. That holds everything in place so that it doesn't come out. If you notice when these are placed, that clay plug is towards the outside of the machine. If you put these in backwards, as it spins, all the heavier stuff moves towards the outside of the centrifuge. If that clay is not there to stop it, it's all going to leave that tube and you're going to end up with an empty tube and a slight mess in our centrifuge. So always make sure you put the clay end towards the outside. Screw the top down here. There's a lid on here that we shut. You're going to set that timer. Most of these run at a high speed for a short amount of time. It's usually about 3 minutes that it does this. Because these are spinning fast, sometimes they make a little bit of noise as they're running. So once it's spun, let the machine stop. Sometimes you have to hit the stop button, but usually they shut off on their own. Let it come to a complete stop. Okay, it's not as much of an issue here, but definitely our other tubes that we're spinning. One, if you stick your finger in there to stop it, you can break a finger. This one doesn't have it, but a lot of our centrifuges have tubes that are blood tubes sit down in. And if you get your finger stuck in there and it's spinning, it could easily break your finger, could injure you. If nothing else, you just spent this time spinning this to get all those heavier parts to settle down to the bottom. If you stick your finger on that and try to slow it down, it vibrates that tube and it actually reconstitutes or resuspends some of that. So you just undid the spinning that you wanted done. All right, so it stopped. It's been our 3 minutes. It stops on its own. We're going to pull that tube out. And obviously, this is a lot bigger picture than what you're going to see. You can see on me. So realistically, if you look at my picture instead of the screen, that is our hematocrit chart. And this is our tube. Okay, so that's what it's actually going to look like when we're looking on things. I made our fluid portion yellow in this so that it is easy to see. But realistically, if that's yellow, we call that icteric. And that patient probably has some underlying problems going on. That should be a clear fluid. Horses are a little bit yellow, and that is normal, but our dog and cat should be clear. All right. Usually we think of liver problems if we see that yellowing there. All right. So this picture here, I'm trying to show you what to do and what not to do. So this last one here, this is perfect. Nope, no, it's not. None of these are perfect. These are all mistakes. So this one here, this second tube is just set against the chart. No rhyme or reason to it. we can't read this. This is not a usable placement of that hematocrit tube. The first one here, your fluid level is matched up to the 100 line, that top line there, but the clay is not on the bottom, so it extends below. On our one here, your clay is at the bottom, but we need the top, this 100 line, we need that to line up with the top of our fluid portion. And this one here, the top does line up with the fluid, but realistically, we want the bottom to line up with the bottom of our blood or the top of the clay. So all of these are incorrect in how they're designed. This one here is correct. So essentially, the clay is below the 0. So our counting starts right at the bottom of that red line there at 0. And what this is telling you is the percent of red blood cells in that blood. The top of it has to be lined up with the fluid portion. So on here, the top of the fluid is at 100, the bottom of the red is at 0, and the top of our blood, our red blood cells here, is going to be, this 40 means 40%. 1, 2, 3, 42. Each line is for 2. So I'd say that's about a 46% for the hematocrit for this patient. Okay. And looking at our chart here, 46 for a dog, just slightly over normal. We would accept that. Okay, that's a okay amount. So this one here, I'll make it a little bit bigger for you. This animal is anemic, or they are low on red blood cells. So I'm going to give you just a minute here to look at that. Remember, the 0 is at the bottom here. The 100 is at the top of our fluid. So what is our PCV on this reading? All right. So this patient comes back with a PCV of 12. Okay, so essentially this pet is anemic and something's going on, whether they have a disease where the body is breaking down these blood cells or they have a bleed somewhere and they're losing blood somewhere. We definitely need to act on this patient and try to get those numbers up. It may be a transfusion. Definitely more blood work is going to go along with this. All right, so this is a quick, simple thing that can tell us the percentage of red blood cells. One thing I do want to note, and I don't have it on these pictures here, is right at the top of the red and before the fluid starts, you're often going to see a white line that develops there. And they call that the Buffy coat. Buffy coat is your white blood cells, and that's why that's that white color. We don't do a measurement on that because it's very small. But a lot of times if an animal has an active infection and their white counts are up, you're actually going to see a thicker buffy coat there than what we normally see. All right, so the next step we're going to do is get a, they call it a total solids or total protein or total dissolved proteins. Has a couple different names that goes along with it. But essentially, we want to see hydration status of this animal. So for this, we're going to use our refractometer. This refractometer tells us specific gravity, so the weight of something. It always measures it based off of distilled water. So distilled water has nothing in it. It would have a specific gravity of 0. So when we use this, I'll show you here. You're going to take your tube and you're going to snap it in half. It just breaks in half. Remember that this is a glass tube. You can cut yourself on this. So we will take it, break it towards the bottom of the fluid. We don't want to break in the red blood cells. We want to break in the fluid portion. All right. And then you're going to take this and your refractometer and you're going to tap onto your refractometer. You can't see it on there, but essentially there is a little dot there in the center of that, and that's going to be our fluid portion. And close this, hold it up against your eye to the light, and it's going to give you a reading on it. So to make this a little bit easier for you, I have some pictures here of what it should look like. So this is our refractometer and our gauge, right? Couple different charts are going to be on this. This one has your total protein over here, and this is a chart we use for urines, and we'll talk about that down the road. Usually for dogs, we want it to be about 5.5 to 7.5, and that's telling us that this patient is hydrated, has a good hydration status. If the number is higher than 7.5 or 8, that means they're dehydrated and they probably need some fluids. If they are lower than 5.5, this means that they are overhydrated. And if they're hooked up to IV fluids, we need to cut back on those or talk to the vet about that because we are overhydrating these patients. So when you look at this up to the light, you're going to see a blue line above and white underneath. And you're going to read that right where that line is. And it's going to be on this SP line over here. Now, this patient, they're looking at urine, but I just wanted you to practice your reading here. So the SP is solid proteins. Like I said, there's different names that this can go by. You have 0, 1, 2, 3, 4, 5, 6, up through 12. This patient here is going to be at about 0.4. So if this truly was a patient and they're hooked up to IV fluids, you are drowning this patient, and we need to jump. We need to get them some medication to take the fluid off of them. Now, this is extreme. You shouldn't see this on a patient as far as their total solids goes. Okay, this one here is more realistic. For this one, your serum protein is this center chart. A little bit bigger here. And this patient's going to probably be about a 7.2. Okay, so still within the normal range, acceptable range for patients. And then our last one here, again, I'll give you just a minute to take a look at it. This is urine. We're not using that right now. The center one is the one that we want to use. So take a look at that and come up with what that patient's number is. All right, if you came up with 5, you are correct. And that is a little under where they should be. So definitely let the doctor know that that's abnormal, and we may have to adjust our fluid rates. So, all right, if you guys have any questions, reach out to your instructor about doing these. This is something that you will likely do every day in the clinic.